Now, for those of you who've seen my prior videos, you know I've been at war with the physical therapy profession, not since I just started practicing, but since I've been an intern. Because you're unethical, flat out. I have multiple videos explaining why you're unethical, seeing multiple patients at a time, continuing to see patients who can't be resolved over and over again. And in my early years, I was holding a cauldron of anger towards this profession. Now, judging by my forceful tone, many of you will say, well, you're still angry. Don't confuse a forceful tone with anger. Because largely I'm not. I'm early retired, I'm largely out of the field, I take periodic contracts only when I feel like it. I've done my bit to try to make the profession better, and the fact is most of you out there didn't. But the amount of anger I had towards the physical therapy profession really decreased in the year 2015, right after I left a fellowship after being there for 3 months and realizing that it was a colossal waste of my time. I thought I was about done in the field within a couple years. I couldn't stand being around physical therapists anymore. And then I got the best advice from a very good physical therapist friend of mine, someone who is not only very highly skilled, has a PhD now, and is now teaching college at the physical therapy program. He gave me this bit of advice, and I have felt better ever since. He calls it the dog analogy. And the reason I'm going to relay this to you is because I've seen a couple videos out there with very young physical therapists that are already burned out and want to leave the field. I watched one young lady who looked like she was in her late 20s, and she presented like she was a very nice person, someone who got into the field for the right reasons, and after only 3 years, even though still over $100,000 in debt, wanted to leave it. Because she sees what I see, that it's totally corrupt, and no matter how much you do for these greedy companies, they just want more and more. In which I'm advocating, find another job, or open your own clinic, or become an independent contractor or travel therapist. My guidebook's at the end of the description for you ethical therapists. You'll have 25 years of tips on how to interview and such, so you can have an easier road than I did navigating who's a good company and who's not so much. But there is a mental health aspect when you're one of the few that are doing the right thing. And if you're doing the right thing in physical therapy, in other words, refusing to see multiple patients at a time, refusing to keep patients who can't be helped, you are going to suffer mentally because you're one of the few who are actually operating ethically. So even though you're in the right, you have to preserve your mental mindset. And this piece of advice that this PT and now professor friend of mine gave really did a lot to preserve that mental peace. And as I said, he calls it the dog analogy. He says that whenever you're surrounded by unethical therapists or therapists who are attacking you because you're the only ethical therapist in the room, first you have to separate the amount of dogs who know what they're talking about in the kennel. And he said you'll eliminate 50% of the dogs right there. And he's absolutely right, and I think 50% is being gracious at best. Most of you, and I'm largely speaking of the outpatient setting, but most of you practicing, you don't know what you're talking about. You don't know how to practice. You've spent your entire career seeing multiple patients at a time. It doesn't matter how many certifications you get, how many extra letters next to your PT initials, no matter what you've studied, if you aren't practicing these skills every day 101, you're going to lose these skills right after the course load. That's just basic common sense. Going to a course or getting a certification is only the ground level entry to these new skill sets. You have to practice them every day to get good at them. And that alone is why most you physical therapists don't know what you're talking about. And I would prove it every day when I was in these remote clinics in Alaska where we are seeing patients one-on-one, when I would come across an occasional traveler who spent their whole career seeing multiple patients at a time. It is incredible how much they miss. And you're supposed to miss things when you're new. I missed things when I was new and outpatient. But as you continue to go to continuing education courses, you're supposed to build this skill set. If you're not practicing this every day, you're not building this skill set. That's just simple common sense. Again, you're largely spending your career handing out exercises and stretches while you try to catch up on paperwork all day long. So the first part of his analogy fits right in with the physical therapy profession. Most of you don't know what you're talking about because most of you aren't practicing properly. So should I care what you think? No. So when all of you attack me and say, well, so you think you're the one in the right and all of us are wrong? Yes. I've known that since I was an intern. because I wasn't in my early 20s, had never had a job, and wasn't going to drink the cup of Kool-Aid that you were trying to thrust down my throat. But that's the first part of the analogy. First separate what dogs don't know what they're talking about. Then you separate the dogs, he says, that aren't willing to hunt. He says you're going to eliminate another 25% right there. In other words, the courage to do the right thing in our field. That's incredibly valid, and again, I'll give that 25% as a number that's being very gracious, because that's the way it's always been in physical therapy with me. Even back to my days when I was working in the skilled nursing facilities, I was the only one who refused to dovetail. I didn't have one therapist who stood with me on this front. And guess what? I was the one in the room who was in the right. Dovetail therapy in the skilled nursing environment is completely shoddy therapy. All these therapists had patients sitting in these small groups, basically just racking up minutes back when it was under the RUG system so they could get the maximum amount of reimbursement per patient. That's what all of you were doing, and you were doing it rampantly, and you know it. You weren't being ethical, so don't get mad at me when I'm calling you on it. But the third part of his dog analogy is then he said you had to separate the dogs who might know what they're talking about, who might be willing to hunt a little bit, but are only going to hunt for themselves. In other words, these are type of therapists who maintain high productivity, usually in these corrupt clinics so they can get better quarterly bonuses, or they're looking for future promotions. They're real go-getters. Except they're not go-getters for the patient benefit, they're go-getters for themselves. He said once you eliminate this type of person, you've eliminated another 15 or 20%. So now we have 50% of the dogs eliminated that don't know what they're talking about, another 25% who are afraid to hunt, and the ones who actually will hunt and might know what they're talking about only hunt for themselves. So basically, we've eliminated 90 to 95% of the dogs in the kennel who are going to be decent therapists in our field. Well, what about the other 5 to 10% of dogs? Well, this is when my buddy said something that was very profound. He said they're not regular dogs, they're sheepdogs. He said the problem with me is that I've spent all these years being angry because I'm trying to turn the regular dogs into sheepdogs when they're regular dogs. And you can't turn a regular dog into a sheepdog. And the regular dogs don't like the sheepdog. The regular dogs don't allow the sheepdog to reside in the kennel. When the sheepdog approaches, they all start barking, baying, howling, because he makes 50% of the dogs look unintelligent, another 25% look cowardly, and that last 15 to 20% makes them look selfish. And every time the sheepdog approaches the kennel, the reason they all bark and howl and bay is because he's reminding them of that fact. The sheepdog largely walks alone in the distance. Sometimes he sees other sheepdogs on other ridges, but many times he walks alone because there's not that many of us out there. And this is my message to the young therapists, especially the new grads, because I've lost all hope and faith in the therapists of my generation. My generation has completely wrecked the field, and I'm hoping the new generation can undo the catastrophic damage that we caused to the field of physical therapy. Most of you will have to decide for yourself whether you're going to be a sheepdog. And if you're going to be a sheepdog, you are going to suffer somewhat. There's a reason I don't have a lot of friends in this field, but the difference after this talk with this good friend of mine is that years and years ago I would have still held anger toward them for being regular dogs, and now I have stoic indifference. When I meet a new physical therapist, I can usually tell within a couple minutes either you're with me or you're not. And if you're not with me, I don't give you another thought. I'm not going to be friends with you, I'm not going to hang out with you. I'm going to largely ignore you and your lack of ethics because I know me trying to change you is largely wasting my breath because you're a regular dog. And this is the attitude the young therapist who wants to be a sheepdog should adopt. Because you know what? You don't have to have a lot of friends in the field of physical therapy. And if you operate in an ethical manner, you're not going to have a lot of friends in physical therapy. But it doesn't mean you can't have a lot of friends. But that's the attitude you adopt if you're going to keep your mental sanity, operating ethically in a field where largely everyone else isn't. There is some mental comfort in knowing that you are the one doing the right thing when everyone else isn't. And the understanding that these other physical therapists who aren't operating correctly, they're just regular dogs. And you can't turn them into sheepdogs. But what you can do is continue to operate morally and ethically, and trust me, you'll be in the position I am down the road of knowing that you did your bit. And I hope enough of you follow this lead of the sheepdog so we can one day say that the physical therapy profession has returned to a state of honor from the state of dishonor that it resides in today.